They must have been asleep at the wheel when the opioid crisis was running its course. Doctors were prescribing huge quantities of OxyContin and other opioids, apparently completely free from FDA oversight. If the FDA did such an abysmal job in preventing the damage from opioid abuse, it seems difficult to have confidence in their ability in any area. Holly, what do you make of this comment from our text club member?
I think it's understandable to be concerned about what's happened with FDA over the years. The opioid crisis is incredibly complicated, and I would separate what's happened in that context from what's going on with regard to the development of a COVID vaccine and other COVID-related therapeutics. You know, pandemic circumstances are unique in many important ways, and so FDA is always between a rock and a hard place in terms of balancing the need to get safe and effective products to patients and providers as quickly as possible. But if it waits too long, right, we lose valuable time. And so, you know, it's difficult for FDA to make all parties happy, and we're really seeing that in the midst of this pandemic, right? We've got the president and the White House really pressuring the agency to just move as quickly as it possibly can, potentially, you know, to the detriment of safety. And we have the career scientists, you know, who are kind of pushing back on that and saying, no, we have an obligation to make sure that we're not putting things out there on the market that might end up hurting people, or, you know, more importantly, preventing them from gaining access to something that might be better.
Sarah, for months, President Trump promised a vaccine in time for Election Day, but that deadline became officially impossible last week. What happened?
It's just the front interest of folk
The president was saying that repeatedly, despite his own federal health officials saying that probably wasn't going to be the case. And so vaccines are still being developed at a record pace right now. We're still on track for
I've worked here for 13 years before I retired.
Or emergency use by the end of this year. And to put that into context,
I was going to the veteran home, but they got it where you can't drive in now. You got to have a code.
Vaccine that took 4 years.
Used to be you could just drive in.
At record speed.
They don't cut that out since the COVID-19.
It did become impossible to meet the president's Election Day goal. The writing was kind of already on the wall.
This used to be an army base.
What happened is that
back in World War I or II.
That kind of was leaving the window open.
It still got barracks. Most of the doctors live in the barracks.
They're not going to be filing for emergency.
They are served now as residents. Some of the housing.
And there's one major reason that that's happening. It should be noted that Pfizer didn't promise it was going to file in October, but there obviously was hope that they would have some positive data that would move the needle this month. But FDA earlier this month issued guidance that essentially beefed up their expectations for what a vaccine maker would have to submit in order to get an
employee parking.
Use authorization for
some of these
shot.
buildings are administrative buildings, equipment repair buildings.
But like Holly was saying earlier about balancing needs with safety,
you name
an emergency use authorization is being used a lot in the pandemic context to.
I'm just scrolling through here. I always like to ride through here whenever I'm up here. It's such a good scenery up here. It's on top of a big hill. It look over Little Rock. You can see the Arkansas River.
To follow at least half of their patients for 2 months after getting the shot.
Used to be you could ride out on the back gate, but they got all that blocked off now.
They're probably going to start getting
So I'm just gonna make a U-turn.
Mid to late November, but even then, there's a lot of expectations that are
bring back some old memories when I used to work up here.
Who are sick in the placebo arm, if they don't have definitive results, that could also lengthen the timeline. There's still just no.
They used to be the marching field for the veterans whenever they
the FDA
finish their training.
Balancing that needs, safety, attention. While we move through this vaccine
over there is the river,
and communicating with the public about what's happening.
So, you know, first of all, I think it's critical to note that despite promises
they out here walking, getting some exercise,
having a vaccine before the election, science doesn't care about the election, right? That timeline was, you know, really not relevant to anything but political kind of ambition and agendas. So I do just want to put that out there. I think FDA,
employees out here getting some exercise,
have been doing their absolute best to emphasize that they know what they're looking for, and they're not going to be pushed to issue an emergency use authorization.
That's the housing area.
Too quickly. Now, an interesting thing happened in preparation for this advisory committee meeting that's happening tomorrow.
I would like to go inside and look at them buildings. I know they antique if they can get.
And they put out a document that mentioned the 2-month additional safety data that Sarah had just indicated. A couple of weeks before that,
Personnel
guidance
for all the
that kind of
employees.
recommendation for 2 additional months of safety follow-up
Home resource
had been,
management,
put
human
forward
resource,
for the White House
personnel.
to approve, and the White House sat on it. They said, we don't need, that extra safety data. Companies don't think it's necessary. We're not going to sign off on this guidance. And so, through some bureaucratic jujitsu, the agency was able to get the substance of that across through these appendices for the advisory committee meeting. Just a few hours later, the White House signed off on that guidance. So I feel
These are
really
some
confident
old
that
buildings,
the career
well
staff
kept.
at FDA really know
Government
what they're doing.
taxpayer
They've been making
owned.
clear statements that if they perceive too much pressure, they will resign from their job. They're not going to authorize a vaccine that they wouldn't feel confident in. But I don't want to sugarcoat things. There are certain trade-offs. Sarah had indicated that the quickest these things have moved previously is several years.
Okay, I'm on my way out.
Safety data
Off of the
is better
regional
than nothing,
council.
right? But it's not
That's where all their
as
lawyers
long as you
work.
would typically have in terms of
I bet they have their
follow-up.
hand
Even
full.
after a vaccine gets emergency use authorization, companies will be expected to continue following up recipients.
Well, let's talk about therapeutics to treat coronavirus. In the spring, President Trump touted hydroxychloroquine, but when he left the hospital in early October, he credited an antibody cocktail by the drug company Regeneron with his recovery.
I think this was a blessing from God that I caught it. This was a blessing in disguise. I caught it. I heard about this drug. I said, let me take it. It was my suggestion. I said, let me take it. And it was incredible the way it worked. Incredible.
Holly, what's happening on the therapeutics front? Has the FDA been able to carry out effective trials of treatments over the past 7 months?
Right, so FDA is not the one that's carrying out the trials, right? It's typically drug companies or sometimes, the National Institutes of Health, and the government agency is funding researchers at academic institutions. A ton of things have been kind of thrown into the hopper as potential therapeutics for COVID-19. And I think clinicians are really facing some challenges here because they have patients who are very severely ill in front of them in the hospital, and they want to do something for those patients. There's this idea that, if they're dying, we are willing to take greater risks in treating them. But I think it's important to acknowledge that we have to gather data about safety and efficacy through rigorous, randomized, controlled clinical trials. And so that's been very tricky, I think, in the clinical context to kind of convince people that they ought to be willing to be randomized to some new intervention or some standard of care or a placebo. Now, when the president talks about these different therapeutic options, he risks he risks the trials that are ongoing because people pay attention to what the president says. If he says this is the good stuff, hydroxychloroquine or monoclonal antibodies or whatever it is, it's more likely that patients will say, oh, that's the thing that works, that's the thing I want, regardless of whether we have adequate data about that intervention. And so I really want to just emphasize, we don't know that the president was cured by any of the interventions that he received. COVID is a wily virus. It affects people in dramatically different ways. Some people spontaneously get better, some people pass away from this virus. And so